little noisier here today than it was the other day. When I was by myself. It's nice and quiet when the rest of you aren't here.
Pretty quiet at my house.
All right, we'll call the meeting in order. And at this time, we will be deliberating on the Healthcare Stabilization Fund Board of Governors and Kansas Department of Health and Environment Health. So we will take Healthcare Stabilization Fund Board of Governors up first. And did not see any major requests. The language that the hospital needs is in there. No one from the hospital is here. We'll confirm it, Megan, that that's correct. Just for the record, the language that the hospital needed for their adjustment is in the bill. Yeah, is it in that one? Yeah. I thought that language was in here. All right, committee members, any questions? Seeing none, I entertain a motion to adopt the governor's recommendation.
Madam Chair, I'll make a motion that we adopt the governor's recommendation. We concur with the governor's recommendation for Healthcare Stabilization Fund.
Okay, I have a motion, second by Senator Kirshen. All in favor, say aye. Motion carries. Next, we'll move on to the Department of Health and Environment. 422 and 23 is what you meant, correct?
Correct. Sorry.
That's what I thought. That's what I thought. All right. Okay, now the Hospital Association doesn't need their language. It's already in there. Megan, would you explain the local health departments where they're at?
Thank you, Madam Chair. Last year, the legislature added $1 million in the appropriations bill for local health departments. That money was carried over into the fiscal year 23 budget, making the total that will be provided to local health departments through the state formula funding, $3.2 million. The Senate Bill 422, which is the governor's base bill, also includes language to raise the minimum amount provided to each of the local health departments to $12,000.
So the money is in there to get them to 12,000.
Yes, that was the language that was put in there last year in the appropriations bill. They still need 2248 to pass. House Bill 2248. So, and that's below the line. So we need to talk about that. I mean, I need to talk about that to leadership. So. All right. So I'm going to just continue on. Yeah.
I know we heard about, yes, we approved $1 million last year, but there was a request for a $1.6 million addition in 2023, using the statutory formula that we made a change to last year. So that would bring their total allocation to 4.8. Is that correct, Megan?
I remember that the local health departments did ask for additional funding, but I don't remember how much. They would have to speak to that.
The governor's budget allocated 3.2, and this enhancement would raise the total allocation to 4.8. I just think we have, well, I believe our health departments have done a tremendous job over the last 2 years. Well, longer than that, but particularly they've been under a great deal of pressure the last 2 years to provide and been recognized for what they've done within their communities to address the increased issues, particularly with the pandemic. And prior to this, they hadn't seen an increase for 29 years.
I don't disagree, but I did talk to Dennis about, I sure would like to know how they spent the money. You know, and I don't have those statistics yet, so I'm going to leave it, I'm proposing to leave it as is, and then if we have that information, when we come to the whole committee, we could maybe try to make an adjustment there. Was it spent on adding people? Was it spent on increasing directors' pay so that we could get better qualified people? Was it spent on, materials? I don't know.
When you say, was it spent, are we talking about the $1 million ad increase that they had after they hadn't seen the increase for 29 years? I think it would probably, we have a whole list of things that health departments do that are provided for us.
I agree, but
it is discretionary for them to determine. And we did just raise last year what the minimum amount that could go to any health department, which is a big move right there, depending on their size.
It was great. They hadn't had a raise for, how many years, you say?
29.
29? Our employees didn't get a raise for 3 years. 4. Anyway.
And I
just want to know how it's spent, because I think if we know how it's spent, then I think.
But I think that's going to vary from health department to health department. They have to, it is discretionary how they use that. They can help with the host of, I can go through this whole list. You have it too.
Another testimony. I just, I want data. Just a little bit.
For a specific health department or
No.
for every health department?
I like to know how the little ones spend it. I like to know how the big ones spend it. I like to know how the East Coast spend it. I like to know how the West Coast spend it. Once I have that information, I promise that when we report to the whole committee, I will, if we see some good stuff there, I'll advocate for it. We could pass over this if you'd like. And that one item. We got more stuff to look at, and, we may be broke by the time we're done.
I'd like to pass over it.
Okay. All right. Got infant toddler services. We've got. Did the governor adopt the increase for postpartum? Did she accept that?
Yes, that's funded in the governor's recommendation
And it's in the.
for the extension of
It's in. So
postpartum coverage. Yes,
okay, and it's in there. All right.
right. That was fully funded.
Got it. What about dental care?
The school-based oral health program,
Adult dental coverage in Kansas.
are you referring to an enhancement request from the agency?
Yes. I don't know that it was from the agency. I know it was from Oral Health Kansas.
The agency had a supplemental request in fiscal year 22 and an enhancement in 23 for $250,000 for the oral health school-based preventative services.
Tanya, can you give me some clarification of that versus the adult?
Well, I can do a little bit, and then the agency can probably do better. The request we have about
extending dental benefits for coverage for adults is not in the agency's budget. It was not, that's something we're just bringing to you. So I think the school-based services was within the agency's request, and I think you guys could probably answer that better than me. If I recall, it wasn't included in the governor's recommendations, but I'm going to stop talking because it's not my thing. I don't know if that helps, but
How much does that cost? Is that 1.4 million?
it's 1.4 SGF and then the corresponding amount of FFP, which I think is 2 million. I would obviously defer to staff who would know the precise amount.
What do we get for that? We get crowns? Do we get crown and bridge? Do we get,
We'd start with fillings, that's for darn sure, because we don't even have fillings.
does somebody from staff have an idea of what you guys are going to use or who would use it?
I suspect, and it's probably Sarah, I suspect Sarah and I and many others would do a lot of negotiating. Is that fair?
Thank you, Madam Chair. Sarah Freddick, State Medicaid Director with KDHE. So it would depend on the amount of money that was appropriated. So ideally, I think what Tanya's group is looking for is a comprehensive adult dental benefit to kind of match what we do with kiddos. So, you know, we cover everything dental-wise for kiddos on Medicaid and CHIP. And I have a feeling what Tanya's ideally looking for is comparable benefits on the adult side. If the appropriations were not quite sufficient to get us that far, then yeah, we absolutely would work with the association and try and figure out where that money could be best spent. So starting with fillings, for instance, or figure out how far that money can go to add more services to adult dental coverage.
Okay, I'm trying to figure out how to explain this. I want to at least graduate to fillings. You know, crowns are $1,200-1,300 a pop. Bridges, you know, I don't know that category, but when you think about a person losing a tooth, that's important. I'm worried about their bite because that's what causes all kinds of other problems. So, but I don't want to come find out that we're whitening people's teeth, we're putting beautiful porcelain crowns on, that kind of thing.
Sure, and I think that would be our approach. If there was an appropriation to start adding services to the suite of benefits that we offer, we would start at the ones that have the most bang for the buck, that are the most directly health related. And if there was some instruction from the legislature where you would want us to focus, we would absolutely comply with that. But that's what we did last time there was an appropriation to increase dental rates. We worked with the association to figure out where could this money be best spent to generate the best outcomes, and that's absolutely what we would do if there was an appropriation for dental as well. And I think what we'd probably want to do is, this is off the top of my head, but I would imagine that what we would want to do is make sure that the money is spent towards the best preventive services so that folks can avoid problems later on, and fillings would absolutely go along with that.
Well, I would support this knowing that it's going to go through a whole lot of other processes by the time we finish negotiating with the House. But in the meantime, is it possible that you could come up with some possible plan that I could have before, I don't know if you can get at this soon. When do I deliver, or when do I, there you are. When do I, I bet I just had to ask these guys. So February 9th, or is it February 7th? I got 9 also. Oh, today is the 7th, 9th, so Wednesday, you got 2 days. Come up with some ideas, just in case I need it.
Okay, sure. Are you thinking kind of baby stepping towards an eventual full adult comprehensive dental benefit? Is that kind of what you're thinking? If we were to start small?
I want prevention. I don't want teeth extracted.
Okay.
And I think we need to be concerned about their bite, because once they're extracted, then their teeth start falling together, and
Sure.
you need bigger floss.
Sure. We can certainly try and pull something together.
Okay. Yeah, if you could get me something. And so As a chair, I am going to support that, but you guys can protest. Huh? If you want, well, we can do this by consensus and then we'll adopt the whole thing. So is there consensus to adopt? Okay, thank you. All right. Now we're back to,
Madam Chair.
yep, go ahead, Senator Petty.
So I did bring up about the school-based preventive services, which is 250,000, which is not covered in, what the governor
What
did not.
page are you on?
Oh, I'm page 14, I'm sorry. And I was just wondering if there was anyone here that might want to speak about those, what those services provide.
I can try and address that for you. Ashley Goss, Deputy Secretary of Public Health, KDHE. So that program is our oral health program within our own agency. There's never been enough funding from the feds to increase our school-based screening program as we need to in order to get more kids screened. So the oral health director, Dr. Dana Brinkman, had asked for that to be put in so that we could increase the screening in schools.
So currently, do you know how many children are being screened?
I'll have to phone a friend. I can quickly get that. I can text Dana and find that out for you before committee's over if you'd like.
Yes.
Okay, let me do that for you.
Thank you.
You know, Dennis used to volunteer to do this 50 years ago. But we don't have the dental guy here.
Madam Chair, Dan Timish, Chief Fiscal Officer. I do have some of that information I could share. Apologize for reading to you, but in terms of the volume, in 2021, the school year, Bureau of Oral Health provided sealants on children in 82 schools statewide, which was a 63% decrease from the prior year in which 220 schools participated. The program provided 749 children with 3,180 sealants, which was a 75% decrease in the number of children and a 33% decrease in the number of sealants placed. And then dental screenings decreased by 54% from the previous school year to 66,278, which was a decrease of 44%. A lot of these drops that I'm talking about were predicated based upon COVID and the study from home, what happened with schools over the last year during the COVID emergency.
So do you have, so those would be the stats for 20, is that correct? Or that for 21?
This is comparing 20 and 21 school year to the prior year.
Okay. Do you have in front of you the prior school year to?
We could certainly lay that out, might be
I
better.
mean, that
to
would
lay
be
that out for you.
more of somewhat normal comparison, the prior
Yeah,
school year.
I would say those are,
1920.
Yeah.
Really looking for a normal, no, you'd be looking at 1819. So what you have provided, though, covers both not only just dental screening, but once a screening is done, then sealants are provided.
yes, I'll give you a list here of the services that we provide. It includes the oral health screenings, sealants, fluoride varnishment, dental cleanings, and then education and data collection in schools statewide. Those are all targeted at preventing oral disease among children that are at high risk of dental decay.
And would this be in like K-6 schools, elementary?
82 schools during 2021, which was a decrease from the prior year in which there were 220 schools. So during the year of 19 and 20, there would have been 220 schools, and in 2021, we visited 82. Big drop.
But as you said, that drop, I'm trying to understand, is not necessarily connected to the funding as it was more connected to COVID?
COVID, yes.
But still, prior year, you were only into 220 schools. Those would be elementary schools, correct?
220 elementary schools.
In the state, right. Thank
And
you.
we only come in if we're invited.
Pardon?
We only come in if we're invited. 220, I mean, what's the deal? Okay. You have to be invited, any kind of cost share for them? Nope.
And I'm trying to get your 1819 numbers right now as well, see if she has them easily. We do have to be invited, and we take the staff in to do the screening. So there isn't any cost share for them because we're providing the service. Some things that we have heard is with screening is it's another screening that has to be done because school's interrupted with hearing and vision screenings as well. So we're trying to figure out how we can do all screenings at once so it's not such an interruption to schools. But the answer to your first question is we do have to be invited.
But there's no cost.
No.
I'll just give a plus for sealants. I think they're one of the best things that ever came about for young children and prevention of tooth decay. So I certainly see a great support for this building. We're talking about dental health for adults, oral health for kids that start early.
Maybe, I don't know. I'll talk to Kevin. Anyway, all right. Huh? Deals with dentists, and they should volunteer in their community. All right, anything else? Got some big items on here. I do have a question before we get back to the big items. So on the testing, KDHE, you're not planning on pulling those out again, are you? Stopping the free tests? Wasn't there a period of time where we shut down the MDL lab and all the free testing went down the tube and then nobody could get tested?
Yes, there was a time. That was because of funding. We've since been able to get reimbursement from FEMA for that testing. So as long as we have the federal disaster in place, which I think the end date is April 1st, is it, Dan? Thank you. April 1st, we can submit those expenses to FEMA. So originally, we did not know if we could get reimbursed from FEMA for the testing, and we since have been able to do that. So all of those labs do know that they're turned back on with KDHE paying the bill through March 31. At that time, then if FEMA does not, if the disaster is not extended, we'll have to cut back.
So you're paying it, that none of that came through Spark money, the extra testing money?
We're paying it now, yes. Dan can give you the division.
Out of your budget?
Yes.
Spark didn't give any money for testing?
Yes, the Spark Committee did give money for testing. That money was spent through, I believe it was $82 million that was funded for testing.
That was a long time ago.
Out of round two, that was very early on. And so all of the testing was funded with CRF dollars through roughly about April of 2021. And when that money ran out, we started using ELC COVID funds, which are direct awards to the agency. And then most recently, we've submitted those expenses to FEMA. And I believe at the end of December of last year, we had our first FEMA project obligated for testing expenses. So FEMA has been reimbursing us for those expenses that were incurred on the ELC grants through the end of this year. At the time we submitted that project to FEMA, the end of the declaration was December 31. And so we're working now on a 2022 FEMA project, so we will continue submitting those expenses to FEMA for reimbursement.
Have you guys done anything to promote the federal tests, free tests? I haven't, I think I ordered mine 2 or 3 weeks ago, haven't received it, but, so are you guys promoting it at all?
I do believe that went out in a release. We haven't received them either. We've had staff that have ordered them as well, just to see what the process is, and they haven't received them either. So we sent the link out. And we've also been trying to keep tabs on when they actually have tests on retail shelves again. They aren't free, obviously, but just the simple fact that they're there and you can get them. So slowly but surely.
Thank you. All right, any other budget items, committee? Yes.
Sorry, I heard that you had some questions about the state formula increase, so Ashley messaged me and I ran over the answer. So I just wanted to let you know.
You can catch your breath.
You know, I can't do a 4-minute, I probably never could.
Yeah.
It's been a while since I've run.
I think mine's a 40-minute walk, so, okay. Senator Petty.
Madam Chair, I'd like for us to talk about the Tiny K $2 million enhancement.
And do you have a page? Or that didn't get recommended?
Did not.
Did not, so I need to find. I got infant toddler.
I can go through some of the information that we
Oh,
received.
here, I got it. I got one.
Okay.
Thanks. Go ahead.
There's been a 60% increase in the number of infants and toddlers served over this last 10-year period. And it's, you know, there are 33 infant toddler services centers in our state to provide, and the amount of money that's saved over time when these services are provided early, and the child, if there's for every dollar invested in early intervention services, the infant and toddler services can yield a 4 to 9. I personally am aware of, you know, with children that have been identified early and have gone through this programming for a variety of reasons, whether it be for fine motor or gross motor, or whether it be for language. It does mean that those services aren't necessarily have to be provided later when they come into the school system. So it's a much more effective and cost-saving measure to use. So I think it's an amount of money that's well spent.
Senator Kirshen.
Thank you, Madam Chair. I just want to say that everything that's been said is, I agree with, and that's the direction we need to head. And you mentioned Tiny K, but isn't there a Johnson County Infants and Toddler program too? The same amount? 2 million.
Or is it the same?
It's the same.
It's the
It's the
same.
same.
Yeah, because there was,
Okay.
you have rainbows as well.
Yeah.
Rainbows is in that.
Okay.
Yeah, there's Johnson County.
You want a consensus or you want to vote?
Consensus. Consent?
I support that.
Okay.
Both of them.
Be broke before we know it. All right. What other items? All right, Dennis, if you've caught your breath, you can come back up. So my question, Dennis, I believe
Absolutely.
I think I asked you out in the hall or something. I'd like to know how you're spending the money.
Oh, yes. Yeah, you did bring it up in committee, and I had deferred at the time to the written testimony, so I apologize. I didn't realize that you wanted my follow-up. But I do have the information now, so I'll be more than happy to share what I do have. It's from 4 health departments. They're obviously very busy with COVID, but in terms of some specific examples of what they used, the last $1 million increase that you all granted last year. So Crawford County Health Department contacted me, and they stated that they used that increase to help do staff pay for retention purposes. And they also did some equipment upgrades at the health department, specifically a urine analyzer and a centrifuge. So that's one example. Then I heard from the SEK Multi-County Health Department. They operate in the southeast corner of the state. They wrote in saying that they also used the formula support to increase staff pay to help with retention, and they also used it for school inspections and some disease investigation. Third one I have from is McPherson County. Their health administrator wrote to me and said that they used the formula increase from last year to make improvements to the structure of their clinic. They had some issues with access, and so they wanted to make the area safer and easier for the community to use. And then the last one that I had in time to print off and bring over was from Reno County, and their health department said that they took the increase from last year and were able to expand what they call BHS, or basic health services, to their at-risk populations. Now, I believe all 4 of these have also written what they would like to use the additional funding for. So if that's a question, I can try and answer that, but I'll stop at this point.
Yeah, I want to know what they're going to use the additional.
Okay. So Crawford County Health Department says that additional funding they think would be a major help in terms of wanting to purchase an electronic health record system, or EHR, sometimes called an EMR, electronic medical record system. SEK Multi-County said that they would like to have additional funding that they would plan to direct towards disease investigation, staff salary increases, investigations of filth and other public health nuisances, and their yearly school sanitary inspections, and some other services they have that they're not allowed to bill for. McPherson County indicated that if there were additional funds this year, they would plan to finish their facility improvements. They also want to partner with local agencies to increase access to safe sleeping resources. And they also want to establish a program that assists new families and infants with utilizing all of the resources that currently exist in their community, but they aren't getting connected to. And then finally, from Reno County Health Department, they indicated that if they were to gain more state formula funding this year, they would want to further expand their basic health services and increase health equity and try and reduce some of their access challenges that they have in the county.
Did you say McPherson wants to do some sleep program?
Yeah, McPherson County, what they specifically said is partner with local agencies to increase safe sleeping resources. I'm assuming, I don't have additional details, so I don't know if that's tied to a homeless program for safe sleeping areas due to inclement weather. That's the only line I have, so I'm afraid I don't have additional details. I didn't follow up on it.
We call it a homeless shelter. Good,
If that's what it is.
exactly. Then we'd know.
Maybe they thought it sounded better.
And so Kirsten is from Sedgwick County, and I'm from Sedgwick and Harvey, and she's from Wyandotte. Heard a lot about the small local health departments, but I didn't hear much about the large ones.
Yeah, I'm afraid I only have the ones that were able to reply to me in time or chose to turn in testimony already, and the larger urban health departments weren't in that grouping this year.
So do you have staff to keep data on how this extra money is getting spent?
I finally got one additional staff, but they're very specific to an immunization project, so it's not something that we've tracked. We could try and track it, but it's only me and one other person at called, and it had only been me up until October, so I do what I can. But so if you want me to try and gather additional data, I can definitely try and do it, or maybe do some annual surveying to track.
Send them a survey and tell them it's due before next session.
Okay, yeah, I'd be more than happy to do it, but are there additional questions that maybe I do have the answers to?
No, I mean, I think one of the things we heard during COVID is we had a lot of people that just kind of moved into the position, didn't really have qualifications, that some left because of stress, because they weren't qualified. I'd like to know whether we were able to increase the pay to get better qualified directors.
And you bring up a very good point. Retention's been, I mean, I actually just got a map over the weekend from KDHE of the latest count of what we've lost since the pandemic, and it's over 60 high-level positions. That's health administrators, health officers, or those that fill both roles in a dual capacity. Part of the challenge that we've run into with pay, because some of the federal COVID dollars have been allowed for things like bonuses related to pandemic work, which all health departments are engaged in pandemic work. But quite frankly, a number of the county commissions have been reluctant to do pay increases. So even when we've had access to some funding, this funding or outside funding, we don't always get the approvals from the elected officials to be able to put that towards pay. So then sometimes they divert that into other areas. Some of them have raised pay and still just struggle to find people willing to do the work. It's not the most popular profession to be in at the moment.
Sarah Kirshen, did you want to say something?
It seems kind of strange to me that to allocate the money and then the county commissioners don't authorize to spend it. That's a real problem.
I mean, it's, yes, of course I agree that that is a struggle. Sometimes the issue on pay, a case in point, an example and I'm afraid I don't remember which health department off the top of my head. They probably wouldn't want to be named in public anyway, but one of the examples we ran into was that other department heads make a certain amount of money at the county. It becomes controversial if the health department administrator, who perhaps was an hourly position because they were also functioning as a nurse, started to make more money than these other department heads, and they become embittered to the idea and resistant to, like, what's everyone else making at the county? Well, this person shouldn't be making any more money than them. All that said, this funding, the state formula, can be used for really any departmental purpose. So a lot of times where there might be a political obstacle on the pay, and pay is the one I always emphasize the most with them because it sounds like it's the biggest barrier statewide. They can use it on other things like service expansion, be it homeless shelters or doing more at-risk services. If those aren't controversial and there's still a need for that, they funnel the funding to where they can get the support. Right, and most of these discussions that I'm referencing back to were tied to COVID dollars. ELC funding that you've heard the agency mention before was a big one that allowed for COVID-related bonuses. And some of that was controversial because one, it's COVID, and two, it was one-time funding. And again, I would emphasize to them, stress that it's you can do a one-time bonus. It doesn't have to be a permanent pay raise, but just the viability of it has been a big struggle. So we've done letters of support to try and encourage the commissioners, hey, take advantage of these resources when they're made available to you. It's like a use it or lose it thing. You know, you want to take advantage when people want to help you. For some reason, it can be a bit of a hard sell. We've worked with the Kansas Association of Counties to try and sell these concepts as well, and they've supported us as an association. But of course, it does come down county by county to each commission. So I wish it was as simple as the state saying, here's $5,000 more for all of your staff. You're going to do it for pay raises, but we don't have a model like that. Well, so far, in all instances I've heard, they do spend the money. They just don't always spend it on pay. So if they can't get pay, but they're willing to do a security upgrade or station changes at the health department to put up sneeze shields and stuff to prevent viral spread, they'll put the resources into that. Or like an electronic health record system, one of those examples, very expensive system to get into, allows you to, reduce a lot of that staff time because you're putting in all these records. It electronically communicates with the immunization database. We're hoping to soon have those systems also communicate with the EpiTrack system for disease investigation, once those APIs are ready to go. But so there's always something to spend it on. It's just not, I see the struggle with the hiring and retention, and this is Dennis personally, not called as an association. I personally wish they would spend more on staff retention because that's the barrier I see. We've got so many new administrators. We're planning an orientation finally, hopefully in late March, to get them trained on what they're supposed to do, because a lot of them are living by the seat of their pants, just trying to do the COVID work. A lot of them don't have any experience on how to do a county budget process or those sort of matters. I mean, we have a lot of obstacles that we need to deal with. And the thing with the state formula is, well, obviously, I do feel that there's always, even if there's a barrier to pay, there's something they can allocate these resources for. we as an association came before you all on this because the formula was set, we understood, to help cover for all those state mandates like the school inspections, the disease investigations, and it just hasn't kept pace with inflation or population adjustments. The 1 million helped. The 1.6 gets us fully caught up, and that's why we sought that, is just to get that back into parity. We're not, in our minds, we're not asking for enhanced funding. We just want things caught back up. And then it might be worthwhile to have some discussions about some targeted programs if the legislature's interested.
Have you been before the House yet?
Tomorrow, so no.
Well, I'm going to make a recommendation that we'd go to $4 million just to keep it in play in the conversation on the table. And I think we need a little bit more information on this. So that's my recommendation. Okay, go ahead.
I just want clarification here because Senator asked a question. I mean, it was mentioned about the funding. So the funding that comes to the county, it has to be spent through the health department funding. You're just talking about the fact that county commissioners are making decisions not necessarily to have it go for pay raises because they don't want to see some inequities in having one director of a health department be a higher, what it might appear to be a higher salary employee than the clerk.
Right. That's one example. So as with state government, I'm much more ignorant on the state, so I'm probably speaking out of turn, but a lot of counties have pay structures in place that the county commission sets. So pay is a little more complicated than any other program simply because they have, definitely for their department heads, but oftentimes there's an entire step and grade system that they have adopted. And so if you're wanting to make exceptions to it, you have to get their approval. It's not something that the administrator can often do, is just go and say, okay, well, I'm not going to get anything, but all my staff nurses are going to get $3,000 more. They can ask, and then the commission, some of them have put those dollars towards it. But of course, I hear from the ones that haven't because they complain.
So then the dollars have to be used within the health department, but they can be used for other.
Yes.
For this list of programmings that we have here.
Right. So what I keep calling the state formula, which is this aid to local from the state general fund, that is under 65-242. That can be used by the health department in a discretionary fashion. So anything the health department that benefits the health department, they can commit those funds to. So it can be pay, it could be something that's not mandated, it could be a voluntary service, whatever. That's why we like it so much, is it's flexible.
So we don't have to worry about that the county commissioners are not using this funding for items under the health department.
Right. They have to use it for the health department.
Thank you.
All right, we had consensus on that. Is there any other items? And on that item, Megan, would you write it per the formula on the health department? All right, so I have down, we've agreed on adult care, dental coverage, tiny K funding, 8.8 million increase for health departments, right? No, 0.8, which is half of what. What else, Megan? Tiny K was the full amount, was that 2 million? Was that school? Oh, that's right. Sure.
I have a question concerning the newborn screening. And Ashley, could you answer that about? about the cap.
Go ahead, Ashley.
So what's your specific question, Senator?
Well, I just had in my notes about the new board screening, about lifting the cap, that there's a current bill.
Yes, and let me find my notes so I can give you the exact bill number too. But yes, there is a cap on the newborn screening, I believe at $2 million. It's House Bill 2250 is what it is. It was introduced last year to raise that cap to 5. It's sitting below the line right now. And the reason for increasing that cap is because we've seen over the last several years expenses come close to that $2.5 million, if not right at it, to exceeding it and finding money to continue to support that program. The newborn screening program, as I reported last week, we screened for 34 out of the 35 newborn issues that could happen. And that is the program that we pay for. So the screening happens at the provider, it comes to our lab, we report it out and then work to get the infant and parents referred to services depending on what is identified.
Every state screen for everything?
Most states screen for a majority of things. Let's see.
Like, are we going to get a prize because we're at all three?
I can ask. Certainly, Senator McGinn, I'll see if we can get a prize.
Not us, the state, or, I'm like, you guys asked for some money, a couple of years ago as well, and
We did, and so we were able to increase what we screened for, because at that time, we weren't screening close to the 35 recommendations that come from the Federal Screening Act. And so now we've increased to all but one. We're lacking one screening is all. And so that can help get that screening implemented. And keep in mind, all of the recommendations to screen for these programs come from the newborn screening. We have a board that's made up of physicians and specialists and such that look at this and review these in order to make the recommendations of what we should be screening for.
what are we not screening for?
We are not screening for X-linked adrenoleukodystrophy.
We have a lot of that.
1 in 17,000.
State that's 2.7. What happens if they get it, or if they have it?
We aren't screening for it, so we're not identifying it. So if a physician is screening for it by ruling out other things, screen for it, identify it, and then they would make referrals out. Just, we are not screening for that.
Why don't you send me that name on an email so I can look it up?
Okay, I will do that.
I believe I can write it down, what you just said, so.
We'll email it to you.
So when it comes to the newborn screening, the bill, HB 2250, to raise the cap, was that also including raising the screenings from the 34 to 35, or was it to raise the cap to accommodate? That's what I thought.
It was just to raise the cap.
To accommodate the screenings that
Right.
is currently going on.
Right.
Madam Chair, I don't know your feelings. I'm just wondering if if we might in our report have something to the effect that we are in support of this bill.
I want to see what the House does. Are they deliberating or just hearing tomorrow? The House. Yeah. The hearing is. Okay. All right. Then, yeah, put in there, we encourage 2250, raise the cap. Okay, I'm good. We're back to, did we have a money amount on schools? Was that already in there? What did we decide? 250. 250,000. Got it. All right, anything else?
I just wanted to ask the question because is CHIP in this budget? I mean, okay. we didn't really talk about CHIP, you know, it's a big issue because we're not getting the same amount of funding for CHIP, and maybe Megan is the expert here, should speak to that issue. If you wouldn't mind, Madam Chair.
So the federal match for CHIP had been decreasing, and for the last 2 fiscal years, the agency had asked for SGF funding to help make up for the increased amount of SGF that's needed to fund the program. The amount that the FMAP is decreased is leveled out for the most part, so that additional funding was not required in this year's budget. The money that was already put in is funding the program.
The money that's already in is funding the program at the decreasing level, or, because I thought last year we were going to be like 22 million lower than what?
Correct. And so there's 19 million added to fund that. The money that was budgeted for Medicaid expansion, once that didn't pass, went to fund that. So there additional 19 was added. And then the governor had a budget amendment that it added the additional amount that the agency needed.
Okay, so that's in the budget then.
Correct.
Thank you.
All right, everybody good?
Madam Chair,
Yes?
when you are finished with recommendations, do you mind if I run through what I have to make sure I have everything right? Okay.
You want to do it now?
Okay.
And then we'll make a motion.
All right, I have 1.4 million SGF for adult dental services provided through the state Medicaid program. I have adding, I believe it's 0.8 million. I'll double check on that to bring the amount that is available to local health departments through the state funding formula up to $4 million. I have adding 2.0 million SGF for the Tiny K program. I have adding language to support House Bill 2250 to raise the cap that can be transferred from the medical program assistance fee fund to the newborn screening program. And then the school-based oral health and 250,000 for the school-based oral health. And that's all I have.
It's been a lot in an hour. All right. Somebody want to make a motion to approve the changes to the governor's budget on KDHE? Have a motion by Senator Kirshen, second by Senator Petty. Discussion. Seeing none, all in favor say aye. Motion carries. Thank you all. We are finished, and our next assignment is Wednesday, state hospitals. We start state hospitals. Yeah. Yeah. And then I kick this out on the 9th. That's Wednesday. So tomorrow, tomorrow state hospitals.